I'm Jeannie Moore, host of NurseDeck, an online resource for nurses that we who are looking for real life experiences and a whole set of career resources. Today we're talking to Patty Taylor, a wonderful nurse of 55 years from the wonderful state of Alabama. Patty, can you introduce yourself to the community?
Hi, my name is Pat Taylor. I became a nurse from a diploma program hospital based in Mobile, Alabama in 1965, and I've had a wonderful career both in acute care and long term care. And I'll tell you a story right off. When I was in acute care, I thought that the nurses in long term care were those who could not make it anywhere else. But when I got into long term care, I realized that the best nurses needed to be in long term care or home health because we don't have a supervisor, we don't have a doctor down in the ER or walking the halls. It is you in that situation and the patient. And what you know and your judgment is what makes the difference in that patient's outcomes.
Awesome. Well, as we were getting to know one another before this interview, I want to hear more about the story of how you started in nursing because in 2021, there are about 72 different ways to become a nurse. And I think that lay people think a nurse is a nurse is a nurse. And I think that we have more than 1,000 different ways to put letters behind our names through certifications and specialties, etc. So if you wouldn't mind, tell us what it was like in 1965 when you just, go through that whole story of what made you become a nurse.
Well, I always wanted to just get married and have 12 boys so I'd had a whole football team. That didn't happen, so I went to college. And when I got to college, I was there a year and a half, and I realized that the morals of people were not what I was raised to be. And so I couldn't handle that aspect of it. And so I quit. Well, it just so happened that the local school of nursing, which is 35 miles away in Mobile, Alabama, two people had dropped out of that class of 57. So my aunt, who was a nurse supervisor over in the hospital that affiliated with the School of Nursing, called Mama and said, "You think Pat wants to go?" So I went over and took the IQ test, which we had to take back then. You had to pass the IQ test and then you had to pass the interview to meet their standards before they would take you. And they took me and a girl named Joan Peebles from down in Lillian, Alabama. Our
Mhm.
class, I'm going to tell you this story. She'll have to hush me up if.
No, you go right ahead. I love stories.
But anyway, we had 57 girls in our class, and back then only women were in nursing. You lived in the dorm, and the doors shut at 7 o'clock on Monday through Thursday.
Mhm.
It was open till 10 on Friday and 11 on Saturday and 10 on Sunday. Now, if you came in early at 10 on Friday, you could stay out till 12, but you had to let them know, which I didn't always do. But
Mhm.
anyway, our director of nurses told us in the first day, she said, "Now, girls, look to your right and look to your left because 3 years from now, one of you will not be here
Uh-huh.
because you will have become compromised. Now, girls, we will love you and we will love your child, but we will help you pack." So,
Wow.
what she did is she just made us mad.
Right.
We were the only class that graduated 57.
Awesome. Awesome. It's fascinating. It's just absolutely fascinating. I'm listening to your stories, and I have an older sister that's 10 years older, and she's the reason why I became a nurse because I came home crying one day and she said, "Oh, be a nurse. You'll always find a job." And just the difference, our experience of entering the field throughout the years is it's amazing to me. Um, you had a little bit extra information in your story about how the steps they made you go through. to enter the nursing field? So you said something about a test that you had to take?
Oh, yeah, we had to pass an IQ test. If you didn't pass the IQ test, you didn't even get an interview.
And so the next thing they did, so you had to pass an IQ test and then you had to have a formal interview. Who did you interview with? Did you interview with a panel or?
We did. We had, I guess it was several of the instructors in the school and the administrator of the hospital and the director of nurses of the school.
Okay.
And you had to pass that interview, and then if you pass, they let you in.
And so what kind of questions did they ask you?
Oh, gosh. I can't remember now. That's been a long time ago. But whatever they asked me, I must have passed it because, well, I've always had what my mother called a tender heart.
Mm-hmm.
And so nursing is, quite frankly, I think nursing is a calling of God.
Mm-hmm.
And I also think that you're going to get good nurses from any background, uh, any type of education, if they were ever going to be good nurses.
Right. Well,
And
yeah,
yeah,
and the program that you went to. So I graduated in 1987 and I loved when I got out of it was a BSN program and I fell into it because I had no idea about the different types of nurses. Um, but when I graduated, what I did was I fell in love with my nurses who had diploma degrees. They were amazing. Just they just I learned more from them in my first few years than I ever did in nursing school.
yeah.
So this was a diploma program, so it was a 3-year program. And did you hit the floor in your whites the very first day? Can you kind of describe what that was like?
Well, we hit the floor in our uniforms and we were there for report. Uh, Before we left the dorm, though, we had a lady that was over the laundry that measured your hemline
Oh, wow.
before you got to leave. She inspected your shoes and she looked and made sure that your uniform could stand on its own if you didn't have it on for the starch that was in it.
Wow.
But we basically, the hospital was manned with students. They had a head nurse and they had supervisors. Everything else was student nurses. Now, you had all
Wow.
3 years of sophomores, juniors, and seniors, but we did everything with the supervision of the head nurse and, of course, the nursing instructor. And we worked 8 hours. We worked the entire shift, and we were totally responsible for everything on a set of patients.
Mm-hmm.
When we got off in the afternoon, we had about 30 minutes before class started. And class started at 4 o'clock, and class went usually to 9 or 10 o'clock at night.
Amazing. So
So,
that was your class time was from
right,
4
was
o'clock
after
until,
your work.
oh, I thought I had it bad. I'm telling you. So when did you study and when do you feel like the classwork you had to have a lot of time for studying or what? Kind of tell me your life work balance going through
Well,
school.
we affiliated with University of Alabama. They had a mobile center,
Hmm.
and we actually had a couple of days that we would go down to the center, and we had our own cadaver so that we could see the dissection and the how everything laid out. I mean, it was awesome to have because you
Hmm.
understood more about the valves and the veins and this kind of thing and how the gut was actually laid out than you get from a textbook.
Uh-huh.
But the one thing that we did have, we had a chemistry instructor. Now, I took chemistry in high school, I took chemistry in college, and I had to take chemistry again in nursing school. And he was one of those guys that when he gave a test, he would just leave a word out in a sentence. And if you didn't get the word right, you didn't pass the test.
Uh-huh.
So I memorized the book, 492
Oh,
pages of it.
I can imagine. I can
It's the
just
only way you
imagine.
could pass it.
Right.
It
Uh,
wasn't about knowledge, it was about how the book was written. So
right.
it was sort of interesting.
Well, you said that you had a like a head to toe full specimen cadaver.
Right.
And I had to take a zoology class, and I had to take we got rats. And
Wow.
we got a rat, and I named mine Harvey, and we hauled him back and forth to the door and put them in our refrigerators. And
That's
yeah, it,
awesome.
but yeah, and in zoology we got a piece of arm, right? Just like a section.
Yeah.
How would you compare medical school with your nursing school? Did you have a tie-in with the people who were going through medical school at all?
No, not at all back then. And the hospital was not a medical teaching school.
Okay.
We didn't have one of those in Mobile at that time. We do now. But we were just lucky, I think, that we had that because most schools of nursing don't. And there were something like 15 hospital based schools of nursing in the state of Alabama.
15.
And yeah, we were the last state to phase that out. And Alabama, as a result, there were three in Mobile schools of nursing. Providence Hospital had one, Mobile General had one,
Uh-huh.
and Mobile Infirmary had one. We were a not for profit hospital, and that may be why, because a not for profit hospital uses their money to buy equipment and uh, resources and salaries. So the other two were for profit. So sort of
Mhm.
kind of. But
Right.
that would be why we had that.
Right. What my sister Jane is her name, Jane the nurse. She graduated 7 years or 10 years earlier than I did, so she would have graduated sometime late 70s. She tells the story of the relationship between the physicians and the nurses in her day. And she would tell me this when I came out, and I would say, "Oh, absolutely not. Are you kidding me?" But she would say that if you had a bedpan, you were holding a bedpan and you were taking it to the hopper, right? If you
Hmm.
saw a physician, you were instructed to find the closest closet and jump into it and shut the door. And this was a debate about whether or not you got up out of the chair if you were charting and let a physician sit
Oh,
down and those
definitely.
type of things. And I'm sure that we're in 2021, we're just the newer nurses are just going, "Are you kidding me?" So what was the relationship like between nurses and doctors?
Oh, you absolutely. If a doctor came up, you stood up and you made sure he had everything that he needed, and you were as unobtrusive as can be. I
Mhm,
do want to tell you a story about the first hospital that I worked after graduation. I worked in a
uh,
35 bed medical hospital,
mhm,
and it was staffed on the night shift with one nurse, which was me, and an aide who was 70. And we had to give bed baths to all the patients at night. So if they rang the bell, they no matter what they wanted, if it was a bedpan, they got the bedpan and a bath. If they wanted a pain pill, they got a pain pill and a bath. Whatever they needed, they got a bath.
mhm.
And then we had to do the laundry. But I had this patient, and I won't say her name, but we'll say that it was MW.
MW, okay.
And you had little bells that you tapped. You didn't
Uh,
have call lights back
mhm.
then. She'd tap her bell, and I'd go in and I'd say, "Yes, ma'am, what can I do?" "Well, I want something for pain, and I want something to make me shit too." So I'd do that. Well, I got married, moved away, was gone for 5 years. I came back and I went to work at USA, or well, South Alabama then, but it's
Mhm,
Mobile General then. It's USA now.
uh-huh.
And of course, they had call lights and we had interns and all this kind of stuff. And the call light came on and I punched the button. I said, "May I help you?" "I want something for pain and I want something to
Oh,
make me
no.
too."
You are
That's
kidding.
got to be MW. That cannot be anybody else. So I go in the room, and sure enough, it was her.
That is
And she had
hilarious.
had cataract surgery. And so when the doctor made rounds, he says, "Wow, she's taking an awful lot of pain medicine. I was going to discharge her today." But I can't do that if she's taking all this pain medicine. I said, Doctor, if you're waiting for MW to quit asking for pain medicine, she'll be here the rest of her life.
That is hilarious. So 5 years later, she's still asking for the same stuff.
Same
Well,
stuff.
and the nurse in me goes, well, the pain medicine is probably the reason why she can't.
That's constipation. Exactly.
That is hilarious. So, am absolutely falling in love with this next generation that's following me. They're probably my daughter's age. They're in their 20s, really kind of just starting out, and they're reporting to me that they're burning out in 2 years. And so they're putting themselves through, and nursing school, I'm sorry, I'm just going to say this.
I
It is
don't
the most
agree, probably.
right, nursing school is the most agonizing thing to get through because they pack everything that you need to know in that short time frame, and they're burning out in 2 years. I mean, what is the good, bad, and ugly of nursing? I mean,
Well,
would
I
love to hear what you think.
I talked to a nurse the other day, and she said she actually burned out in nursing school, but
Ah,
she graduated and she managed to work 18 months before she just had to quit. I talked to another nurse, and he just had no idea of the liability attached to nursing. He lasted 12 months.
ah,
But part of that, I think they need to back up a little bit in the School of Nursings.
mm-hmm,
And what I have found, even as early as the 1900s, when I was helping with education in a hospital, I set up a preceptor program for every brand new graduate
mm-hmm,
because they got out, they knew theory, but they didn't know how to do anything.
mm-hmm,
And the old saying that nurses eat their young, well, that's true because the nurses on the floor are so stressed out with the jobs they have to do and the responsibilities put on them by management that has no comprehension of what the stress they're under.
mm-hmm,
And then they are expected to precept and teach a new person how to do their job. And so they do a halfway job. They get more stress, and so they're not nice until that person gets burnt out, and they both burn each other out, if you know what I mean.
mm-hmm,
Um, so back in the 90s, this started really that you were having to teach new nurses. They're smart as whips, but they just didn't know how to do anything.
mm-hmm.
And so you needed to show them it's the art of nursing,
Right,
not the science. They had the science of nursing, they just don't have the art of nursing. And
right.
they're not taught how to do or to organize their work so that they can be more efficient at it.
Mm-hmm,
And I think schools of nursing do them a disservice. One is they don't teach them the art of nursing, and they also don't teach them the reality of nursing.
mm-hmm,
They dump them out there, and the poor kids have never worked a full shift. They've never been completely responsible for a patient. They don't know about how the evening shift works and the night shift works and the weekend works. And so they have no concept of the reality of what they're getting into.
mm-hmm.
And employers are expecting them to be able to go
Right,
and do once they
right.
get
Well, and
on
that,
payroll.
and the whole dynamic of the hospital system has changed so much. When I got to the hospital, I walked in knowing that everybody had the same credentials as I did, meaning
Right,
we're all registered nurses, we're all MDs, or and
right.
the dissemination of degrees and the handoff of the tasks and the variety that we have today. um, I always say, not everybody's a nurse. Just because they're female doesn't mean that they're a nurse, and the layperson doesn't know any of the differences between it. I have been dreaming of a system where we put nurses and doctors through the first 3 years together, like the old diploma program. Throw them in there, get them used to what it's like, because they'll weed themselves out if they don't like that
Right.
patient contact. Another thing that I noticed, because I was in a BSN program, I had to work to put myself through school. And so I was always working and then going from one hospital to the other to do my clinical rotation and then going back, and I would study till 2 o'clock in the morning and then rinse and repeat. Um, when I was with my classmates on rotation, they got, especially the ones who got straight A's. I was not an A student. Trust me. I mean, I did the very best that I could, but our grading scales were so much different. To get an A, you had 96% and above. I mean, I was teetering on that low 80s to 90s and getting B's and C's.
Yeah.
And but they didn't know how to tactically do what the text was telling them. And so we would get on the clinic, and the A students would come to me because I had
Right.
the experience on the job, and so it's
Right.
just we gotta rebalance that somehow. Um, I was thinking also, were there classes that we took in nursing school that we didn't really need to take? Is there something we can carve out of the theory and the philosophy of things? And I don't know the answer to that. I mean, I really don't. But we need more clinical time for the new ones. They need to
Yeah,
understand
we
that
do.
what you're idealistically taught is not the real world, right?
Right.
What happens when your IV pump crashes? Do you know how to titrate
Yeah.
a drip? I mean, it's I think this is one of the reasons why I'm actually doing this for NurseDeck. 'Cause I feel so sorry for them. I just can't
Oh,
even
I know.
imagine. It's like they're being thrown to the wolves. And I'm like, this,
I,
no, 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 no.
I can remember a couple of years ago, we didn't have a pump on this patient, and they wanted so many drops per minute or cc's per minute. And I said, well, just count the drops. What do you mean counting the drops? I said, every drip chamber has an X number of drops per cc.
Right.
So you count the drops and you regulate it to get the amount of cc's you want to give in an hour.
Mhm.
And they had never heard of that. I
Right.
said, okay, so you just go get you a Dilaflow. What's a Dilaflow?
Flow. Yeah, I know. We can sit here and laugh, but I mean, I
It's
remember
not
how.
really funny.
Right. I remember when they were throwing patients out of the ICU faster and bringing them to the telemetry floor, and we would have dobutamine and dopamine drips going,
Yeah,
and I would have a staff of LPNs who couldn't manage IVs, and it's
right,
just the safety concerns. Um, one of my favorite things I started saying about 20 or so years ago was the very last place you want to be when you're sick is in the hospital.
right,
And so let's talk about patient safety, right? I think that's probably one of the biggest burnout, uh, the cause of burnout, because we are here to care for and protect our patients. It's kind of That's kind of the job we do, and when we can't, that just compounds our stress. So
right. It
let's talk
does.
about patient safety. We could talk about that for 100 years.
You could. You
Yeah.
actually could. Oh, goodness. Patient safety. That is question number 6.
I'm sorry. I'm going out of I'm not following the.
Well, I think that nurses, they're dumped out and they're not in an environment that is kind.
Mhm.
And everybody is so busy. And so they don't feel like they have anyone that they can go to. And what I see is supervisors are in an office somewhere
Mhm.
or in a meeting with upper management instead of being on their units helping these people out.
Mhm.
And they've forgotten that that is their role. And that's part of it. Uh, and the other thing is, you got to listen to these people. You got to listen to the patient. You got to listen to your staff because the way people communicate things varies so much
Mhm.
between ethnic groups and educational levels and that kind of thing. I've always been taught you try to communicate on a sixth grade level
Mhm.
because most everybody can understand the sixth grade level.
Mhm.
But so you try to keep it as simple as you can so that everybody understands. I can tell you, I had a patient one time in home health. I was working infection control and I needed to give amphotericin B to a patient in this city, and I needed to give an IV antibiotic to a patient 35 miles away. And I
Uh-huh.
called a nurse friend of mine, and she met me at the Kroger parking lot, and I taught her the use of a Huber needle to access the port, taught her about the amphotericin B and the side effects and how it had to be administered, and then how to use the pump. And after 1 hour of instruction, she was able to go and do that successfully. But she, again, was a diploma graduate just like I was, so she had a good basis for it.
Right.
I think your idea of slowing the educational process down and including clinicals is better, and that's going to help patient outcomes.
Mhm.
The other thing I see is nurses have forgotten that they are on the patient's side. They
Right.
are the patient's advocate. And when they get an order that they don't understand or agree with, they have the right and actually are mandated to question that physician.
Mhm.
And I don't care if he says just do it. You don't do it until you are satisfied that that is the safest thing for that patient.
Girlfriend, we could talk about how to handle those doctors that get upset with you when you're questioning them. But one of my most favorite quotes, I was listening to nurses talking about COVID on TV, and the one nurse said, "My job is to question everything." And I
Right.
thought, exactly.
Exactly.
That's exactly right. That it's we are given so much education, and 9 times out of a 10 we're continuing that education because we want to understand and want more information so we can be better for our patient. And so that always leads to questioning everything. Absolutely. What question are we on, Patty? Well, and the other, so okay, so let's go back to where we were before. Um,
Okay.
the advice that you would give a nurse starting out in COVID-19 during the pandemic, what kind of advice? I would say just hold on. This isn't reality. We're going to get through this together. So tell me, what kind of advice would you give this poor person?
Well, I'm going to remind them that they are the liaisons between the patient, the family, the physician, other staff workers, and if they have any questions, they should communicate them with you. And
Mhm.
you need to be open, listening,
Mhm.
attentive to that patient. You I'm telling you, this is the worst thing that could ever happen to patients and families.
Mhm.
They're estranged from each other when they need each other the
The
most.
most.
And so you have to be the person that is the go between.
Mhm.
I had a patient uh, last year that I came on. I worked 6 to 6, the night shift, and she would call every day on the day shift, and nobody would tell her anything. So she would call
Oh.
about 30 minutes after I got on duty, and I would say, "Okay, everything's okay. You call me tonight at 11:30, and then we will have time to discuss everything." because right now I need to go make patient rounds. I just got
Right.
reported to go make patient rounds, but I want you to know everything's fine and we'll talk tonight. So every night she called me at 11:30 and she called me at 4:30 in the morning to get an update before I went off.
Off.
And we did that
Yes.
for about 5 weeks.
Oh,
And he got better. And
right.
actually, what was going on with this patient is the doctor had ordered a medication discontinued. But when the hospital sent the transfer discharge orders, they left the medication on it.
Oh, yeah.
So it took us about a week and a half to figure out what was going on. And he was having an adverse reaction to
Mhm.
that medication and was basically semi comatose.
Right.
Took him off
Right. Um, you know,
and got better.
right. The accountability, you know,
Oh
we
my goodness.
yeah, who in the current infrastructure where everything is in itself, the respiratory therapist comes in and takes care of the vent and they leave. The phlebotomist comes in and draws the blood and they leave. You know, this segmented system in which these nurses are working. There's not one. You probably have experienced this too, where you have five primary treating physicians on a client. I'm sorry, that's a
Yeah,
1987 term for the patient, and they're disagreeing with the orders, and they cross through them and scratch them
yeah.
out, and then another one comes in and writes some more, and you're just like, "Time out here, fellas. We need a powwow. We need to figure out what's in the best interest of this patient because this is insanity. Something is going to fall through the cracks." And how do we get that accountability component built back into what we're doing?
Well, I think unfortunately, it falls back on the nurse.
Yes.
And I had a doctor who would come in and write orders, and I would read the order, and I said, "This is not what he told me he wanted."
Right.
And I would call him and I would read it to him. He said, "Yeah, that's what I want." I said, "No, sir, this is not what you verbally told me you wanted."
Right.
"Yeah, that's exactly what I want." So I just called the next doctor up and I said, "I want you to read me this order and tell me what it says to you." And he read it and he told me, I said, "Well, that's not what he told me he wanted verbally." I said, "He needs to learn how to write an order that's clear in what he wants." So he
Mhm.
just took this guy aside and talked to him. And a couple of years later, this guy was actually in charge of my brother when he had cancer
Mhm.
and did a great job. But he had
Right.
learned how to write orders because a nurse was willing to stand up and say, "Hey,
Right.
this is not clear and it's going to create bad situations for a patient." And
Right.
nurses have to do that. That is part of our responsibility and that's part of our patient safety.
Right.
Because if that case would go to court and they going to ask you, "Why did you do that when he had already told you that wasn't what he wanted?"
Right.
And
Ah,
it produced bad outcomes.
right.
So you have to, for your own liability as well as the patient safety.
Right. Well, it's so interesting to me. I was talking. I'm on the business end of the spectrum and the insurance end of the spectrum. I couldn't stand the quality of care in the hospital anymore, so I said, I've got to go do something else, and went to the insurance company, not having a clue what I was getting into. And in looking back, uh, the whole mechanism from law and business and finance and the economics and the policies and the government I mean, we nurses need to really have this very wide understanding of the world in which we are responsible, but then we need to focus in on the patient. And
Right.
how do you cannot put that into 2-year degree, a 3-year degree, or a 4-year degree. But they got to have this wide exposure to um, everything that's hitting their responsibility in caring for that patient. I don't know how else to other side, but at the end of the day, who is accountable? And then some people would argue that the patient's accountable. They're the
There's
consumer of
no
health.
way patients can keep up with what's going on in the healthcare world. In fact, I tell people if you don't know anything about medicine, you find a nurse or somebody that does to go with you to the doctor, much less to the hospital.
Right,
And that's why we're in trouble now, is
right,
because you can do it with the doctor, but they won't let you in because of COVID in the hospital.
right.
I had a sister in law that at one point they told her that she had no circulation in one of her legs and they were going to cut her leg off, foot off. And I said, don't, Wayne, don't let them do anything till I
Right,
get there.
right.
And it turns out she had Raynaud's. All she needed to do was move away from the glass window that she was in the high rise in,
Uh-huh.
wear socks instead of dress shoes, and wear good shoes and long pants.
Mhm.
And, those symptoms decreased.
Right.
But
I have to tell you, I'm going to just kind of throw this out there as an idea for the world to, because I think you and I are onto something. How about we get rid of the degrees and we pay people based on their outcomes?
hmm,
Because you're diagnosing. You walked in there and you were and that's my number one. I love it. I love doctors who respect nurses because they know that we never stop learning. We
yeah,
never stop learning. And the smartest thing we can do is find the best doc that we're close to and say, teach me, teach me, teach me,
right.
and because so that we can then walk in and go, you know what, back in 1982 I saw a patient like this and it was this.
Exactly.
Let's check for that.
I had a patient in a nursing home, and she kept developing these sores on her skin, and they kept ordering things, and they couldn't figure out what it was. So they had this surgeon come and to look at her, and he looked at me and he said, "Well, Pat, what do you think it is?" And I said, "Well, I think it's latent syphilis." And he looked at me and said, "Of all the nurses I know, you're the only one that I know that would think of that."
Mhm.
So he did the biopsy, and guess what it was?
It was
Latent
latent
syphilis.
syphilis.
Yeah.
Amazing, isn't it? Yeah.
Yeah.
We need to do something. Otherwise, the one on the business side where I've been living, we called, back in, so we had patient, the word patient. And when I went through school, we were transitioning to the client.
Yeah.
And in my latest world, it's the consumer of healthcare.
Oh
And
my
that
God.
drove me nuts. I'm just like, you know what? No one consumes healthcare. I understand what you're trying to say, but because there, look at the amount of training that we have to go through just to be a nurse, just or a physician, and they still don't know it all. So,
Yeah.
how do you expect the average person to consume anything from that world?
Right.
It's just, it's unforgivable that we think people can consume it intellectually.
Right. Exactly.
Right.
It's not possible. You mentioned insurance. I
Uh-huh.
I go to the doctor, and the last time I went, his bill was $161.
Mhm.
The insurance approved none of it. I go to the podiatrist, and her bill is $96. The insurance approved $8.46. Now that's what she got paid. It is ridiculous that a physician who has spent years of study and tremendous amount of money
Mhm.
with years of experience is making $8.56 for 20 minutes of service. I don't care.
Right.
So we're talking about they're making basically minimum wage for their education, and we have people with no education out in the streets wanting $15 an hour to slap a hamburger on a piece of bun.
Mhm. The
It
whole
just
thing's
does
upside
not
down.
make sense exactly.
Right. Well, there and that's the reason why we need to our young folk need to understand how the government interplays, how policy and legislation comes into play. Um, and we need and I used to wrote actually something that I posted on LinkedIn. I said nurses are in every sector, in every corner, and in every nook and cranny. And we just need to band together because I don't know the first thing about lobbying in government, but I
Right.
know that there's got to be a team of nurses that do, and
Yeah.
so it is. Um, the other thing is nurses and these number of different degrees that we have. Can we just all settle on the fact that it's all baloney? Because ultimately, at the end of the day, you got your state scope of practice. You can have 14 doctorates in Timbuktu, but if your scope of practice is over here and you don't want to move, you know,
Right.
what are you going to do with all those degrees? You're still locked into that scope of practice.
Right.
So there is uh, so much work to be done to take control and build a better healthcare system for our patients. That I talk to a lot of nurses who are like, "Oh, it's gonna go to AI, artificial intelligence. We're gonna have robots at the bedside, and it's all gonna go to this, that," and I'm like, "It can't. It will get us up to a certain point, but I'm the nurse that puts the machine on the patient and then watches the patient,
Right.
not the machine, because I
Right.
know the machine can be fallible, but my eyes and my brain can override anything anytime. So, and we just have so much stuff to go. What define quality of care for me in your
Quality of care is when a patient has a problem. You assess that problem, you identify the problem, and you put in place a correct plan of care and action that resolves that problem. That's quality care without error, without mishap,
so precision.
precision.
Precision is what we're looking for.
It's also got to be done with kindness and perception for the needs of the patient, both emotionally as well as physically.
Mhm.
You can't just address the physical needs of the patient, you got to address the emotional needs of the patient.
Mhm.
One of the things that I was always taught is no matter what your educational level or socioeconomic level, people know the difference when something is clean or dirty.
Mhm.
So you never take dirty equipment in a room, you never take dirty supplies in a room, you don't show up dirty, and you treat that person with respect.
Mhm.
Because if you bring a dirty piece of equipment in a room, then they're going to look at that and they're going to think, well, if that looks that bad, what about other things? And they're going to start looking.
Mhm.
So we need to pay attention to the things that we take into a patient's room
Mhm.
psychologically for them.
Mhm. I'm going to kind of go off of our questions here because I'm very fascinated in asking you this question. There's a lot of conversation around theories or processes like motivational interviewing or how to converse with a patient, how to from a training perspective. And I look at some of those and I think I d- I question some of these theories And some of these, uh, why are we teaching that to nurses? Uh, when there's a balance we want to achieve that we're not hitting yet. We're not achieving that. The S in my BSN stands for science. I've never taken a class in comparing in compassion and caring,
Yeah.
right? I've never taken a class around how I personally treat a patient. The caring and the compassion comes from within.
It does. There used to be a class back in the diploma.
Back in the diploma days.
Was class on that. But the reality of it is, if you don't have it in your heart,
Mhm.
it's not going to show in your actions. If
Right.
you have it in your heart, it's going to show in your actions. And that's why I say it's a calling of God, because
Mhm.
you have got to love people and you got to care about people. And
Mhm.
if it does, it's going to automatically show up.
Mhm.
I've had people that watched me work and said, "You're a Christian, aren't you?" And I
Uh-huh.
said, "Yes, I am." That's
Mhm.
happened many times because of the way I interact with people.
Mhm.
And you not only have to do that with your patients, you got to do it with your coworkers.
Right.
Everybody, that's the thing. We're not taught customer service.
Right.
The patient is our customer. Your coworker is your customer. The doctor is a customer. The dietary aide is your customer. The housekeeper is your customer. And we are customers too.
Mhm.
Management forgets that part, by the way.
Mhm. Mhm. Yeah,
But
I think the leadership whole thing we need to take a look at that too, because I rarely saw my house supervisor or whatever we called them. They were in the office or they were gone off the floor. And how did they possibly know what was going on in their unit?
they don't.
They don't have a, and I'm not sure what their meetings are all about or what's so important about those, but definitely have to figure out this leadership infrastructure that we have going on.
Yeah,
Because that's not working for me either.
it's not
So
working.
I want to know, what do you see of the future?
I am worried about the
And
future.
be kind, all right?
I am worried about the future.
Yeah.
What I see in medicine, unfortunately, is that we're treating symptoms and not diseases.
Mhm.
And when used to, back in the 60s, if a patient was on 2 or 3 meds, that was all they were taking.
Mhm.
Well, then around the 80s, if they were taking 9, that was basically it. That was the guideline, no more than 9.
Mhm.
Well, now they come into the long term care facility and they may be on 35 or 40 or even 50 medications.
Mhm.
There's no way that those medications are doing what they were prescribed to do, because you've got so many side effects from all of those medications. So we're treating the side effects that the medications cause.
Mhm.
And part of that is because big pharmacy's in control.
Right. Well,
Big pharmacy's in
we
control.
we could take this conversation political really fast, and I'm trying to kind of stay away from that because, quite honestly, I think that we need to encourage these young people because I see some magic in a few of them, you know? And just like anything else, I don't see the magic in all of them,
Yeah.
but I see enough sparkle in a few of them that, and the technology, just don't use the technology wrong. Don't use it in the correct manner to help us. Don't, like oh, I used to get so angry. 20 years I went to an internal medicine family practice doctor who stood at the computer to have the conversation with me, and he listened to my heart and lungs, and that was my physical, besides the blood work. He never touched me. I never had my abdomen palpated. He never checked my pedal pulses. He never looked at the skin
Yeah.
tags every never.
I had a nurse practitioner that took my blood pressure, and I asked her to take it on my lower arm. And this was this year. And uh, she put the stethoscope above the blood pressure cuff, and she came up with a blood pressure. Well, you
Really?
and I both know she didn't, but she had never taken a blood pressure on the lower arm before.
Right.
It was amazing.
Amazing.
It is.
Yeah.
But where are we going? I think, gosh, those people, as I said earlier, those people that's going to be good nurses, going to be good nurses no matter
Mhm.
what.
Right.
The problem is that I just hate to see them thrust in the middle of all the chaos that's going on.
Right.
And there's a lot of it, with a lot of extra stressors that probably shouldn't be there.
Right.
But
Well, let's talk a little bit about COVID for just a little bit because I've been trying to wrap my brains around this just a little bit because the medical society, what I'm going to say, doctors and nurses, let's just lump those two entities, is split down the middle.
yeah,
How can we be split down the middle if we're all following science?
well, I think part of it is because, to be honest, this was a generated virus, and the research is not there. If you look at all the vaccines that have been made over the years, most of them took years and years and years and years to make, and all of a sudden we make a vaccine in 6 months. So we don't know the science of the vaccine. So that's part of why we're split. We don't know what the side effects are going to be 3 years from now from taking a vaccine. And then you can't take government out of it. They're
Yeah,
mandating what everybody does. They're taking the freedom of choice out of it, which builds resistance for those people that believe in freedom of choice, which most Americans
mhm,
do. And so it's just an unfortunate situation. If we didn't split on something else over these years, this is probably going to split us as much as anything.
right.
Um,
Well, the other thing is that we have had one side censored, and I don't think people know that, right? We
mhm.
we have physicians out there who are just trying to hit the drum, hit the drum, hit the drum, and if they're on social media sites, which is where we go, right,
Right,
to listen, they're being censored.
right,
So it's like if and these are very incredible top of the branch, I mean, I don't know what else to tell you, but
right,
people know these doctors and scientists, but you can't hear what they're saying because they're being shut down.
right,
So, unless you know to go hunt for that voice, you will never be exposed to it.
yeah,
The other thing is talking to people who were there in the front line, talking to expand your network of colleagues. Talk to the nurse that was there at the front line. Talk to the physician who was actually there, who can tell you their story. And I just think we just need to take a big breath, and let's kind of just hone down. For a while there, I was arguing with medical doctors, saying, where are your critical thinking skills? Where are your critical thinking skills? And then it bothered me so much. I went out and did research and found out that allied health and nursing education programs instill critical thinking skills. But if you go through medical school, they have a tendency to stomp out their critical thinking skills. So they're more like engineers
Yeah.
than what we think of as the old school doc. And they're because there's so much that they have to compact into their training and their education that it stomps out that critical thinking. And I'm like, wow, can that be possible? Could it be possible that we are building these doctors that don't have critical thinking skills? I'm just I mean, I want somebody to research that like endlessly so we can figure out whether or not that's true. I personally think that nurses are going to save healthcare. We're
Say
the
that
only
again.
I said I personally think that it's going to be nurses that save healthcare.
Oh, I
And
think
the
you're probably right.
right. And the reason why I think this is because regardless of where you sit on the paradigm, whether you're in the hospital setting and the provider, or whether you're on the payment side of things, our number one job is patient advocate. We're here to
Right.
protect the patient.
Right.
And that's the reason why people trust us
Yeah.
because I'm not gaining any additional take home money by telling you A versus B.
Right.
And that's the reason why people trust us.
Yeah.
And I don't want to lose that as we go forward.
Well, the surveys, all the years that I've been a nurse, nurses were the most trusted profession of
Hmm.
any profession, and that has not changed in all these years.
Hmm.
Um, I was going to tell you, I can't remember which year it was. I'm thinking it was probably around 19, in the 1990s, that the nurses' agenda was prevention,
Hmm.
preventative medicine. And let me tell you, when that hit the fan, when AMA found out that nurses wanted to do preventative medicine rather than episodic medicine, which is what doctors do. They
Hmm.
treat you when you get sick,
Hmm.
and so it's called sick health care
Hmm.
instead of well health care. And we want to do
Exactly.
well health care, prevent you from getting sick.
Hmm.
And that's why nurses, the number one role is, or a major role is education.
Right, right. Well, and that was one of the first things to get stripped away from us in the 80s and
Yeah,
90s. I mean, I when I first started, I had 4 cardiac patients. I had the time to teach them about their medications. I taught them
the
alternative
diet.
right, their diet, uh, how to lower their stress, how to reduce your pain without medications. I mean, I had a lot of time to really impact their lives. And within 3 years, I had 12 patients.
Right.
That whole education just went right out the door. And I think that that is critical. The other thing that nurses, I think, are really good at is saying, I don't know the answer to that question, but let
But
me
I
go
can
find
find out.
out.
Mhm.
Let me go find out because I've got friends in low places that will have that information.
Well, you talking about the education aspect. In 1998, the American Dietetic Association decided that diabetics should not be on a special diet.
No kidding. See, I'm not even up on
Oh,
that.
yeah. They decided that diabetics should eat everything that everybody else did, including chocolate cake with icing, and that they should chase their sugars with insulin, which meant that here goes the sugars.
Yeah,
All
yeah.
right, so they did that. Every facility in the country, hospitals, long term care facilities, rehab facilities, went to a regular diet for everybody.
Right.
Doctors were not aware of it. They were still on
Yeah.
ADA diets and expecting ADA education and all this kind of stuff. Couldn't figure out why they were getting all these phone calls at 10 o'clock at night with these high blood sugars
Uh-huh.
because they're regulating their patient based on that ADA diet and their insulin, and they should be okay, but they weren't because they weren't getting it. If you look at the diets in the hospitals today, you will see all carbohydrates and a little tiny piece of meat. It is carbohydrate, 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 carbohydrate.
Right. I
No just snacks anymore with protein in it.
right.
They get sugar cookies.
I tell ya, I
Mm-hmm.
think we are in 2021, the healthcare system is harming and hurting and killing people at an unprecedented rate.
Yeah,
And I think we have reached a tipping point of being angry and enough is enough.
yeah,
We just need to get the right people involved to support our new enough mission,
yeah.
whatever that mission is. Because I'm trying to stay apolitical on all things, and it is so hard. But it is, how can we educate each other? How can we keep these nurses in the system? I want them there. I want the best of the best to remain. I want people to lose their licenses for gouging the system. I want the fraud, waste, and abuse removed out of this system. And if you're caught doing it, you lose your license. End of story. You don't get to go from state to state and start up again.
Right.
Um, my personal story of reason why I got on this passion wagon is what I call it, is my sister-in-law. I lost her at the age of 52. And long story short, she had one surgery for an anterior posterior spinal fusion, and then met a doctor who said, "Yeah, I think bariatric surgery is a good idea for you." And she went ahead and did it without telling me. And that was the beginning of the decline because I'm like, You are so full of adhesions. You are the last person that needs this. Do not, so anyway, I ended up losing her very young and major lawsuit, major court case. And he's practicing somewhere else in the United States right now.
Wow.
And there were 6 plaintiffs on the lawsuit. So yeah, we need to step up our game. I think what we ought to do is get all the nurses to keep everybody out of the current healthcare system. Build our infrastructure so that we can keep as many people out as possible. That sounds like a really good idea to me. Um, so anyway, what do you so this NurseDeck thing is pretty awesome.
Yeah.
I've not met these guys. But it's an online community for nurses, and I really would like to help them. What else kind of fun stuff can they do? I think we need to hear from the older nurses. I think we need to figure out a way to teach and educate and demonstrate um, our our lived smart stuff that we can bring to
Right.
the table.
Right.
It's like when you draw an ABG, do this and this because whatever it says in the text doesn't work, right? It's like here, where the NARC keys over here, not here, because the cabinet's over here versus here. Yeah, that all that smart stuff that we learned by doing. Um, if we can share that, I think the more the better. I
Yeah,
would really
I
like to,
agree.
yeah, and get nurses cross trained. If you've got an interest in law, by golly, go down the law track. You know, we need you out there in every corner.
Yeah. When when I left Bamanette, I'll tell you, the hospital was back in the day when they used oxygen tents.
Uh huh.
You
Uh huh.
had 8 cylinders that were taller than I am, and you had to have a hand truck to haul them in.
Right. Right.
And if they were on oxygen, you called the family. Then later, we didn't use IVs back then. You had hypodermoclysis. Have you ever heard that term?
No. No.
Okay.
Hyperdialysis.
Hypodermoclysis is when you took a spinal needle and you connected it to your tubing in your IV and you stuck that spinal needle in both thighs. And when the lump got about this big, You clamped it off, took that out, and you stuck it somewhere else in the thigh. And the tissue would absorb the fluids. That's how you gave fluids back in the day. It's
No kidding.
hypodermic lysis.
Hypodermic lysis. Isn't it just
Lysis.
amazing? I'm
Yeah.
telling you, that's amazing. It's amazing.
And
Well, and so much is, I mean, when you age, you see, okay, this is the what we thought in the beginning, and we no longer think that all these years later.
yeah,
And look at what we were teaching patients back here and what we're teaching them now.
right,
It's like right now everything is about inflammation.
right.
Coronary artery disease, hardening of the arteries,
It's
get those statins on board. We don't care about your muscle pain because it's all about getting those lipids down. And now they're saying, "Oh, wait, maybe it has more to do with inflammation."
exactly blocking the cell from transport across the cells, and this is,
Right.
yeah, I
Yeah.
know,
It's like science is going like this, and how are we gonna keep up?
right.
Yeah.
And there are 10,000 theories out there.
Oh,
And
that's the
who
problem.
do you believe? Who
Right.
do you believe?
Right. That's one of our biggest problems. I'll never forget when Lancet published an article, and they had, like, a group size of, like, I don't remember, 169 or something, and the whole world exploded about this article, and I'm like, "Wait a minute." In freshman nursing school, in nursing school, my freshman year, I was taught you cannot reference a study unless there's 1,000 or more participants in that study.
Yeah.
Why are we referencing studies with 160 people in it?
Or 10 people or 20
Oh,
people.
I know, right? It's just
Yeah.
mind blowing. I just can't. Oh, and it's gotten so bad because I do a lot of writing. And it's gotten so bad that I'm like, "Do I really wanna quote that organization?"
Right. That's why I always liked Harvard. I used to go to their program in the spring because their research had a large base of people that they did their research on. And
Mhm.
if you didn't meet the criteria, they didn't publish their
Right.
research.
Right. What happened to our rigorous review?
I mean, really,
Yeah.
that's,
Is it really all about the money?
I think it is,
Is it really all just about the
unfortunately.
money?
And we have doctors that are good doctors.
Yes.
They can't keep up with all this stuff.
No, if you're in it for all the right reasons, you can't keep up.
No, you can't
There's
keep
no
up.
way.
And I feel sorry for them. But you get the new doctors and they don't have what the old doctors have.
Right.
You know what I mean?
Right.
So they've lost the art of doctoring. Here we go again with
Right.
the art of doing something.
Right. Well, and we used to tell doctors there's no art in medicine. It's all science. The art are the nurses.
Yeah, yeah.
The art is the
And you got to
nurses.
remember, doctors are just practicing.
Oh my goodness. That is wonderful. I apologize to all the doctors that I love and who love me. We're not talking about you. Uh,
They know we love them.
yeah, they know we love them.
I know you have, and I have certainly worked with a lot of very, very good doctors.
Yeah. I always loved the ones who taught me the most.
Yeah.
They respected me enough to spend the time to teach me what they were to teach me. And that those
Not only that, but they were collaborative.
right,
In other words, they utilized your years of experience because I was older than most of the doctors I ever worked with, except in
right,
the early years. And so, they always ask, Pat, what's your opinion?
right.
And we'd make rounds together. That's another thing we've lost.
Mhm.
Even the supervisor doesn't make rounds with the doctors anymore.
Right. Right.
And so the doctor doesn't have any input into that patient except what that patient thinks about at that moment.
Mhm.
And I used to write a synopsis on every patient my doctor was going to see
Mhm.
and gave it to him. So he had it in front of him when he was talking if I wasn't going to be with him.
Mhm.
And he discussed every patient. But I tried to make rounds with my doctors because
Mhm.
the things I had seen, the things, my assessment, they were interested in knowing.
Right.
And that's a valuable input to the outcome of that patient.
Mhm.
But if you don't assess patients, then you're not any good as a nurse.
Right. Right. Well, and the assessment thing, we're no we that we I have yet to see anyone assess a patient. I don't know if they're doing that anymore.
Yeah.
You know, are they taking a full medical history and doing remember that book we used to write?
Yeah.
Or the physicians would write? It's like I have not seen that done in many, 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 many years.
I want to ask you a question.
Yeah,
You're in
sure.
the insurance side of it now.
Uh-huh.
How difficult is it for you to glean information from a medical record that's put on computer that has separated everything about that patient? I mean, I've looked at patient charts that have gone to lawyers and tried to discern, what was the blood pressure and pulse on that day? What was the blood? Nothing is together anymore.
Right. Well, the data analytics is very fascinating because what we're talking about is the cartel. That's what I call it. It's a
Okay.
complete and utter cartel, completely and utterly driven by people who are making money. And the data analytics, I'll just give you one small example. Insurance companies create a health plan report for employers. The design of that report, very sophisticated data analytics and a huge engine that goes through predictive modeling and sorting of all of this data points, right? But the health plan report that the employer is seeing is actually designed to do one thing, and that is to sell another product.
Yeah.
So they identify the cost driver of that employer population, and then the broker comes in and says, "Well, here's the solution to fix it." And my clinical brain looking at it going, "Why are you paying attention to the diabetics as a whole when there's a huge difference between a type 2 phase 1, type 2 phase 4?" The claims data is only half of the information.
Hmm.
And so we're starting off with half only half of the it's just insanity. So anyway, I I think that when you don't know what the cost of something actually is, that's when you have a real problem. How much does it cost for that hospital to perform that CT on that patient? Somebody tell me what that actually the bottom line cost is.
Yeah.
And right, it's insanity.
Well, do you realize that a urinalysis costs $700 now?
Oh, it's just
Asinine. I am sorry. It's a dipstick and some pee. For crying out loud.
Well,
That's
yeah, we could get started on the whole cartel is another 7-year
crazy.
conversation. Yeah, it's insanity. Uh, but it's really fascinating. I think that what we're learning as we start to come together and have these conversations, it's no longer us and them. It's like, okay, let me understand your world. You understand my world, and then let's come together. Because I'm sick and tired of nurses working as hard as they do. And, nurse practitioners, when they first I remember when they first came out with that degree,
Yeah.
they were making 130,000 a year. So everybody went, yeah. What is it now? 80, 90?
Yeah.
What, we saturated the market with nurse practitioners and so now we can drop the pay? Wait a minute. The thing we need to educate the public to is a nurse is not a nurse is not a nurse is not a nurse. And how do we do that? And I say the only way we do that is to take ownership of it.
Yeah.
We need to take ownership of it and then protect it like hell. So, uh, yeah, wouldn't it be wonderful though to have a small group of patients that you love and adore and that you're responsible for, and then you have the technology to support them in any need that they possibly have, and you have experts on direct dial,
Right.
and you can do a conference call. And oh, hey, you know what? You know that open heart surgery that I put my dad through and the chemo I put my mom through? I told my daughters, not happening here. I'm going to reach a certain age. I don't want any treatment. If I'm diagnosed with anything, then show me the morphine.
Yeah.
And that's my right.
Well, that's basically what where I am now
Right.
because I have lived a great life. I've had a
Right.
lot of fun. I've loved nursing and I've done nursing and it's been very rewarding. And I know that I've helped people along the way. But I don't need chemo. I don't need to put that poison in my body.
Right. And that's your choice.
And
That's
that's my choice.
right. And I
Exactly.
and I don't want my children.
Children to have to worry over the decision.
Right. Right. Let us make those decisions now when we're of clear mind. It's the same thing is I never wanted my mom to go into a nursing home. Not going to happen. And so you just you figure out your lives to keep mom home.
Yeah.
I mean, and if you don't have anybody in your family to do it, find a nurse. She'll help you figure it out.
Yep.
I think that's where we're at.